Hi friends. So it sounds like we had a question about how to inject into the masseter, and I thought it would be easier to do a video on how to do it versus actually trying to describe it. So the first thing I want to say for the disclaimers is that this does not replace having good knowledge of anatomy and physiology, and of course only do this if you're licensed in order to do this type of treatment. But the masseter is actually relatively easy if you know your anatomical landmarks. And so the masseter is right through here, and it works really well for treatment of bruxism. TMJ, yes, if you have teeth clenching, but not necessarily if you have locking of the jaw. If you got locking of the jaw, then Botox is not going to be an ideal treatment for this. So what you're going to be looking for is that person who is clenching, but if they do this, they're not having that locking of the jaw, then they're the ideal candidate for this particular treatment. So what you're looking for is the masseter muscle. And for patients who are doing a lot of teeth clenching, if you have them clench, you're gonna feel that muscle right there. It just pops right out. So feel for it, have them clench. And I can feel mine because I do a lot of clenching and it's right there. Other important structures that you need to know about your masseter, you've got your zygomatic major and minor, your risorius, and then your conglomeration of muscles, which is called your modiolus. You want to make sure you don't get into those because you will actually change their smile. So there are a couple of injection techniques. I personally like to do just a one-point injection because it minimizes the risk for it to go into a place that I don't want it to. If you are very comfortable with anatomy and you know it really very well, then you can get slightly better spread if you do more than one injection point. For me, I just do one and I've had great results with my patients. And I will do anywhere from like 10, which is really very, very low, but I have had some success with 10, generally 15 to 25 per side. And it takes about 2 weeks for patients to tell you that they're starting to get some relief with it, but patients will tell you they're waking up in the morning and they're having less problems with headaches and whatnot. I did want to show you a picture of me, and I had my masseters injected. We were trying something different, so we were trying to walk it out and see if we could get better spread, and it did affect my risorius, and I ended up losing my dimple for about 6 weeks. I'm going to show you the picture. It's actually quite ugly. So here it is. Yeah, so the top is the injection, and you can see it's a very ugly smile, and the bottom is my regular smile, which you can see my dimples in my teeth. So be really very careful how you're doing this injection technique, but if it works really well, your patients are going to be very, very happy because they're going to have less problems. I did want to show you this little muscle man, so make sure you know facial anatomy really very well. And the other pointer that I would say is that your Botox needle, I prefer the 1/2 inch versus the 5/16. You can find them, and it will go a little bit deeper into the muscle because, you know, especially if you got somebody with a poofy cheek, has a lot of volume in their cheek, you may not get deep into that muscle like you want to give it that good control. Typically I will start between 12 to 15 units for each side if they're a brand new patient for me, and then have them come back in 2 to 3 weeks, and if I need more, I'll add more. I have done 25 to 28 for patients who have really strong muscles who I know very, very well, and we've kind of worked up to that point. So there you go for masseter injections. I hope you found that very helpful. Bye.